Hi everyone, and welcome to the Respiratory System Part 4. And in this section we'll be looking at lung volumes and lung capacities and how we can determine these. In the course of normal breathing, a person takes approximately 12 breaths per minute, and that's about 500 millilitres of air per breath. This is known as the tidal volume. Approximately 70% of this will reach the alveoli, and the other 30% remains in the conducting airways. This diagram looks very busy, and I do appreciate that. However, we're going to go through each of these in turn, and I'll refer back to it during the session. The first measurement on this that we've already discussed is the tidal volume. So this is the smallest of these arrows, and it refers to the normal relaxed breathing that we do subconsciously. So before we consider each of those measurements in the graph, we need to consider a few other factors as these play a part in measurement. The anatomical dead space is the amount of inspired or inhaled air that never reaches the alveoli for gaseous exchange, and this is approximately 150 millilitres. The physiological dead space refers to the anatomical dead space plus the volume of non-functional alveoli. Normally, these two measurements will be almost identical. However, respiratory disease, such as emphysema, can affect the alveolar walls, and as they begin to degenerate, they will increase the physiological dead space. The minute volume is the tidal volume, so that's the normal volume of air that is inhaled during resting breath, times the breathing rate. So that's the amount of gas inhaled and exhaled in 1 minute. The minute alveolar ventilation rate is the amount of inhaled gas which is available for gas exchange during 1 minute. So this is the tidal volume minus the dead space times the breathing rate. An example of this calculation would be the tidal volume of 500 millilitres of air minus 150 millilitres of dead space. This gives us a value of 350, which times 12, the normal resting breathing rate, would give us a minute alveolar ventilation, 4,200 millilitres of air per minute. So just to remind ourselves, the tidal volume is the volume of gas inhaled and exhaled during normal breath. The inspiratory reserve volume is the amount of gas after tidal volume that can be inhaled with effort. So if you consider taking a very deep breath in, that would be your inspiratory reserve volume, and this is between 2,000 to 3,000 millilitres. The expiratory reserve volume is the amount of gas after tidal volume that can be forcibly expired. So this is if you force the air out of your lungs, and is approximately 1,200 millilitres. Even after a forced expiration, there will be a residual amount of air present in the alveoli. This is known as the residual volume and is between 1,000 to 1,200 millilitres. So if we return to our busy diagram, we've covered the tidal volume, which is normal resting breathing. The inspiratory reserve volume is if we take a very large breath in. The expiratory reserve volume is when we force air out of our lungs, and the residual volume is the volume of air that will be left in the alveoli after this point. So these measurements in yellow we should have an understanding of. The forced vital capacity is the maximum amount of air that can be forcefully expired from maximal inhalation, and it refers to the inspiratory reserve volume plus the tidal volume plus the expiratory reserve volume. The forced expiratory volume in 1 second is known as FEV1, and as the airway resistance increases, this value will decrease accordingly. Lung capacity summaries may be calculated from 2 or more of the pulmonary volumes. So the inspiratory capacity is tidal volume plus the inspiratory reserve. Functional residual capacity is the expiratory reserve volume and the residual volume. Vital capacity is the inspiratory reserve, the tidal volume and the expiratory reserve. And the total lung capacity is the vital capacity plus the residual volume. This diagram is found within your textbooks and is similar to the previous diagram. So we can see the tidal volume, which is 500 millilitres approximately. We discussed the expiratory reserve volume and the inspiratory reserve volume, which is if you maximally exhale and inhale respectively. And the residual volume is the air that's left in the lungs. So the functional residual capacity is the combination of the expiratory reserve volume and the residual volume. The inspiratory capacity is the tidal volume plus the inspiratory reserve volume. Vital capacity is the inspiratory capacity plus the expiratory reserve volume. And the total lung capacity is the vital capacity plus the residual volume. In the next session, we'll be looking at internal and external respiration.